that about $260 million would be needed to upgrade the sewage system at the Korle-Bu Teaching Hospital. That's according to its chief executive, Dr. Daniel Asari. He revealed this on Monday when the Health Facilities Regulatory Agency, HeFRA, issued a license to the hospital to operate. JoyNews' Beryl Ernestina Richter was at the presentation and has filed this report.
In January this year, HeFRA embarked on a tour of some health facilities in Accra that had not been accredited by the agency. The authority issued a March 31 ultimatum for Korle-Bu to begin processes to be licensed or risk closure. Speaking at the presentation on Monday, Dr. Daniel Asari noted there is a need to rehabilitate some infrastructure at the over 90-year-old facility.
Some of the things which are 100 years old can never sustain itself now. Even the underground sewage which goes into this thing is asbestos. We're changing them alone will cost no more than less $260 million. And I think the Ghana government is aware of that.
He admits this is cost intensive and the hospital is looking at lobbying and working with the Ministry of Health, Finance and other relevant stakeholders to address the situation.
We don't have a sewage treatment plant, and that's a capital project. So we need to lobby, facilitate, talk to the Ministry of Health and get the sewage treatment plant in place. Probably join to the Lavender Hill one so that the compost, all the fecal matter can go into a compost manure. So it's an action plan drawn and with the government, with the Coastal Development Authority. Some of these things are already in the budget, and we can do that within a period of 4 or 5 years. Yeah.
Meanwhile, Acting Registrar of the Health Facilities Regulatory Agency, HeFRA, Matthew Treme, who presented the certificate to the Chief Executive of the hospital, cautioned other health facilities to register with the agency or face closure.
I believe that we as a country today can share the positive news that Korle-Bu is now legally licensed in accordance with Act 829. And that is positive news. And what that means is that other facilities that have not done what they're supposed to do should have to take a cue from what Korle-Bu has done so that we can register them, inspect them, license them, and make sure that we can monitor them on a regular basis.
The hospital, which had an overall score of about 75% at the end of the assessment by HeFRA, has been given a 6-month period to present an action plan on some findings in the report. Korle-Bu Teaching Hospital becomes the second teaching hospital in the country to be accredited by HeFRA after the Komfo Anokye Teaching Hospital.